Welcome to Toronto Children's Services Screening Tips and Considerations training module. Screening is conducted to limit the introduction of infectious disease into the program. Agencies must create their own screening processes. The latest symptoms for screening and exclusion can be found on the Ontario Ministry of Health webpage under Guidance Documents. This document is updated periodically, and screening processes should be modified accordingly. All parents and agency staff should be aware of signs and symptoms of COVID-19. Every staff, child, and visitor to the centre must be screened prior to entering the childcare setting. The childcare centre must have a designated screening area located at the front entrance, blocking entrance into the childcare centre. Only one entrance or exit should be used. It is recommended that visual lines, such as tape markings, be used to identify where families are to stand to ensure safe physical distancing from screening staff. Print and post Toronto Public Health signage in a visible location at the designated screening station to raise awareness about health and safety measures that can prevent the spread of COVID-19, such as physical distancing, protect yourself, information about COVID-19, wash your hands, cover your cough, and poster for entrances. Provide visual guides to assist with physical distancing, for example pylons, in the event that a lineup forms while parents and their children are waiting to be screened. Alcohol-based hand sanitizer must be available in the screening area, out of reach of children. The screening area must be disinfected regularly and as needed throughout the day. While working in the screening area, the staff conducting in-person screening and temperature checks should wear appropriate personal protective equipment, including a surgical mask, gloves, and eye protection at all times. The designated screening area must allow for a minimum of 2 meters, 6 feet distance between staff conducting in-person screening and the individual being screened. Alternatively, a protective barrier, for example plexiglass, can be equipped around the screening station. Ideally, the screening station is equipped with a main screening table and a side table. At the main table are health screening forms, pens, tissues, hand sanitizer, thermometer and disposable caps, disinfecting wipes, gloves, masks, and eye protection. At the side table are COVID-19 resources and hand sanitizer. Upon arrival at the centre, the family should be greeted and requested that only one adult enters the screening area with the child. Request that both the adult and the child use hand sanitizer. Advise them to remain behind the taped line at all times. Using the most recent screening question from the Ministry of Health, ask for a yes or no response for each of the questions. Then take the child's temperature, recording all the information. All childcare licensees must maintain daily records of screening results. Records are to be kept on the premises. Remember, the thermometer must be disinfected after each use, and if disposable ear cups are used, they must be immediately discarded into the garbage. If the individual answers no to all questions and does not have a fever, which is 37.8 degrees Celsius or above, record no on the health screening checklist. they have passed the screening and the child can enter the building. If the individual answers yes to any of the screening questions, refuses to answer, or has a fever of 37.8 degrees Celsius or above, record it on the health screening checklist. They have failed the screening and cannot enter the building. Direct these individuals to visit the Toronto Public Health website to learn about assessment centres and testing. Ensure that door handles and any other surfaces the individual has touched are disinfected immediately while you are wearing a mask and gloves. Perform hand hygiene before and after glove use. Pre-screening is conducted by an individual prior to leaving their home to come to work or attend a childcare centre. For example, a staff member pre-screens themselves prior to coming to work, or a parent pre-screens their child before going to the childcare centre. When you pre-screen, check your temperature. A fever is a temperature at or above 37.8 Celsius, and check for any symptoms of COVID-19. If the child or staff exhibit any symptoms or have a fever, they must stay home. Direct these individuals to visit the Toronto Public Health website to learn about assessment centres and testing. That concludes the screening training module. Please inform your supervisor or director that you have completed this training module. We have provided a list of additional resources for you to access related to screening processes. They can be found on the website along with this video.